So as we jump in, we are going to be focusing on the signs, symptoms, and treatment options related to substance use. And I'm going to cover a wide range of things. And so we'll talk about different substances, the symptoms that come with substance use, how to start to see when substance use is a problem for you as well as other people, and then getting into treatment and different treatment options that are out there more generally, resources that can be helpful, as well as treatment here at Sharp Mesa Vista. And then, of course, any questions that you all might have. So thank you again for coming. And as we dive in and start to talk about substance use, I think it's important to think first about why people use substances. And so as you think about yourself and your own substance use and people in your life, people use substances for a variety of reasons, especially for children and adolescents, but also for adults. There's a social component, a fitting in. It's what other people are doing. I want to experiment and try something new, but also people start to use it as a coping skill, to take a break from stressors that are happening in their lives. There can be a cultural component of substance use. And so as we think about substance use, people don't use substances for one specific reason. There's a lot of different reasons somebody starts to use substances. And I want to decipher a little bit between substance use and substance abuse. And that when people start to abuse substances and become reliant on them, typically what we're seeing is they are avoiding what's going on, something that's going on within their life, that their life has become too overwhelming. And the use might have started out as fun and experimentation and social, and then we start to see this reliance and this inability to manage different areas of their life that leads them to that substance use. And there's a difference between substance use, experimenting, socially fitting in, trying something out, cultural reasons to be using, and becoming reliant or dependent on it. And so we'll talk about that as we go. But I want to share with you all a quote that I think is really important. And this was from somebody who was in recovery. And they say, "We don't choose to be addicted. What we choose to do is deny our pain." And I thought this was really salient because, again, it speaks to this piece of people are not addicted to substances because it's fun. People are addicted because there's something that they're having a hard time dealing with. And so this is their way to cope. And when we think about it in that way, the coping, it works until it stops working. And we think of that with all of our coping skills, that the coping skill works. That's why we do it, right? Avoidance works until it stops working. And so you can think about somebody who maybe is working full time, has their children, is going through a breakup in a relationship. At the end of the day, when they finally get the kids to bed, they sit down and they have a few drinks. And it's a way for them to unwind and relax after their day, and that works. And then they start to need it and be thinking about it all the time and want it when the kids are up. And then we start to see more of the addiction component of it. And so again, what we start with is a substance use, relaxing, winding down after a long day, and then we get into, for some people, addiction. I need it, I'm reliant on it, I want more of it. And that's that avoidance of the pain that would be going on for that person with being a single parent now and losing the relationship. And so I think it's so important when we think about substance use and when we think about substance abuse that it's not simple, it's not one answer, it's very complex when we try and understand what's going on for this individual and how can we best support them. For sakes of this presentation, I want to just quickly talk about different substances. This is not exhaustive of a list by any means, and I'm not going to go through all of the details of it. But I do just want to call on a few pieces of this. Some are things that are more common that you all maybe have heard of or come across in some way in your life. And some of these substances might be more new to you. So of course we start out with alcohol, and I have a number of different ways that alcohol might be referred to. Of course, there's many more. We also have marijuana, starting out with the legal ones, and then we get into opiates. And so looking at prescription opiates versus opiates you might get on the street. So very common opiates: hydrocodone, Vicodin, oxycodone, Oxycontin, tramadol, fentanyl, which is getting a lot of attention more recently. And I have some names up here of ways people on the street refer to fentanyl. It's important to know that fentanyl can be prescription, that there is a medical reason to use fentanyl, and that it can be really great in the medical setting for pain management, for anesthetics in the emergency department, but also in the operating room. And then there's also fentanyl that's being manufactured on the streets. And that is very different, not controlled. It's not clear what's in it. It's not being overseen by the FDA or any body in that way. Heroin, an opiate that is on the street, that's manufactured on the street. Oftentimes you'll hear people's stories. Sometimes you'll hear people's stories, and they started with prescription opiates, and then it became expensive and really hard to obtain. So they started resorting to more of what they could get on the street: heroin, fentanyl from the street, things of that nature. I also have on here benzodiazepines. Again, some of the common ones listed. Benzodiazepines used to treat anxiety, something that people often Xanax on the street, people will call Xanny bars. Oftentimes used for anxiety management, but other things as well when it's prescribed. Methamphetamine, something you'll get on the street with a number of different names that it's referred to. With hallucinogenics, there's a lot of hallucinogenics out there. This is not an exhaustive list. Oftentimes you'll hear mushrooms referred to as shrooms, ecstasy as E. But again, not exhaustive by any means. We have cocaine. There is crack cocaine versus cocaine, which has a difference. And then the last one that is a newer substance that's coming out and around is xylazine, which is referred to as tranq on the streets. And a note about xylazine and just what it is, because some of you may have never heard of it. So xylazine is a medication that's used in veterinarian medicine. It's predominantly used as an anesthetic and muscle relaxant for animals. There's no approval for it to be used on humans. There's no research for it to be used on humans. What they're finding is that xylazine is being added to fentanyl and heroin as a way to try and elongate the euphoria effects. And we'll talk about these different substances and the effects of them. But so it's being added to other other substances. And we don't know so much about the effects on human because it's not made for human consumption. And there isn't research, and we're not giving it to humans willingly because it's not a safe medication or option for them. And so this is one that is leading to a lot of overdoses. It's leading to a lot of wounds, actually. It's creating a lot of infectious wounds that are happening and concern. So it's a newer substance. I don't share it to scare anybody. Again, depending on if you're a clinician or if you're a parent. If you're a clinician, you might come across this at some point. And so knowing a little bit about it could be helpful. But then starting to look at what substance use can look like within the body. And so again, some of these you're more familiar with alcohol. We're really looking at that impaired motor functioning. You might think about seeing somebody on the side of the road doing a test with a police officer, right? Touching your nose or walking in a straight line, reciting the alphabet. We're going to see a lot of impaired motor functioning, slurred speech, impacts on their coordination. And so when you're thinking about if somebody is under the influence of alcohol, those would be things that you may see. Now, I think it's important to mention that substances impact everybody differently. And so it's not always going to look the same in everybody, but these are some common things that we would see. With marijuana, historically, we would see red eyes. More recently, because of the different strains of marijuana that are out there, because of the amount of edibles that are being utilized, we're not seeing red eyes as much. For some people, it gives a lot of this relaxation, and for other people, it gives more anxiety and paranoia. And again, that's where each strain of marijuana is going to impact somebody differently, and also marijuana is going to impact each person differently. as we get into opiates, opiates really have a place in medicine, and they're meant to manage pain in some capacity. And so we can see this increased relaxation and happiness that happens. But there's this difference between a medically prescribed amount versus taking an amount that's not medically prescribed, that isn't taking into account your body and the other medications you're on and your own abilities to process something. And so when somebody overtakes, we start to see the drowsiness, the confusion, the nausea, the concerns around eventually slow breathing, or the depression of the respiratory system. With benzodiazepines, we're going to see, again, it's used to treat anxiety. So we're going to see this relaxation when it's the proper dosage of it. But we can also see a real flatness within somebody, or drowsiness that happens as they start to, their body's just really slowing down in a way that's different than their typical presentation. With methamphetamine, you're going to see a lot of increased energy. You're going to see going hours, days without sleeping, and then a crash. You're going to see a lot of movement within the jaw, within the lips, within the tongue. Those are going to be signs that somebody could be under the influence of methamphetamine. With hallucinogenics, again, there's a lot of different hallucinogenics, but it's when taken in, when people are using it in a dose that is, if I could say, socially using it, we see this like increased energy, this excitability, this gigglingness, excitement, sensitivity to senses, and then it can get to this level of paranoia for some folks, and depending on the amounts. With cocaine, we're seeing this increased energy, very hyperverbal. We can also see agitation or irritability that comes up with it, but a big sign of cocaine is that increased energy, which is a little bit different than the methamphetamine, because we're not going to see the jaw movements and the face movements as much. And then finally, with the xylazine, you heard me say earlier that they're utilizing this in order to try and increase and lengthen the euphoria feeling with the other substances. And so that's the goal. And at the same time, again, not made for human consumption, and can create a lot of really serious concerns in regards to slowing of breathing and heart rate, loss of physical sensations, things that can be very scary. And so I share about the substances and what they might look like, because it's important as you start to notice and see what somebody around you could be potentially using. Of course, we never want to say, oh, I see you have red eyes, you must be under the influence of something. But these are things, signs or symptoms to start to look out for when we're noticing if somebody could be under the influence. So as we start to think about like when substance use becomes a problem, the big thing, again, from the beginning, we talk about that substance use can be social, it could be experimental, it could be cultural. When we start to see it being a problem is when it starts to really interfere with your day-to-day responsibilities. And we'll get more into what that might look like in you and in your children. But again, when it starts to get in the way of you doing the things that you're needing to do. And so maybe you used to use occasionally, and you would smoke some marijuana, and you would go to work and you would get your stuff done. And now you're noticing that you're starting to call out more. And it's really impacting, again, your day-to-day responsibilities. You're calling out from work more, from school more. And so that's a big sign. We also want to see when your body and your mind starts to become reliant on the substance. And your body and your mind aren't going to become reliant at the same time. So one maybe before the other, but there's this yearning for the substance, this need for the substance, this looking for the substance, wanting the substance. That could be a warning sign to you that maybe something is going on. Maybe I'm starting to become reliant on this, or it's starting to become a problem. And so when you look at yourself to begin with, when substance use becomes a problem for yourself, when you start to cancel a situation, and there could be a variety of reasons here. So you're canceling because you don't have enough substance to manage the situation, or you're not sure when you're going to get the substance or how you'll get it, or if you can go that long without it. those would be concerns. If you think of an example, could be a vacation, a trip, and you can't fly with your substance. And so you don't go on the trip and you're canceling this trip and you're not engaging in this interaction because I need my substance. And why would I go if I can't have my substance? Those would be warning signs to you. Spending a lot of time thinking about the substance, thinking about using it, acquiring it, trying to figure out how to get it, even thinking about not wanting to use it anymore, trying to stop using it and having a hard time stopping using it. Those are all signs that it could be a problem, as well as when your body becomes physically dependent on it. And withdrawals are something we'll talk about a little bit more later, and detox and the importance of that. But your mind might become dependent. You might be thinking about it a lot and wanting it, and then your body might start to become dependent. And a really good example of this is with alcohol. You wake up in the morning and you're feeling really sick after a night of drinking, and maybe you're starting to shake a little bit, and so you think, oh, I'll just have another drink and that'll just help me, right? People will sometimes kind of joke about that. That would be a sign, a warning sign to you of like, maybe this is a problem for me. I'm needing it and becoming reliant on it in order to feel okay. So thinking about that's looking at when it becomes a problem for you. But now looking at any of you that might be logged in as aunts, uncles, grandparents, parents, friends of people who have kids, when does it become a problem for our kids, our children and our adolescents, and how do we know? And so what we're really looking for within our child and adolescent population is anything out of the ordinary. If they are normally very extroverted and now they're introverted. If they normally are very introverted and kept to themselves and all of a sudden they're extremely outgoing, doesn't mean they're using. It's something to notice. It's something to get curious about. It's something to pay attention to. If there's a big change in their school performance or engagement, again, in either direction, we want to look at, is there this increased secretive nature of what's going on? Are they starting to close their door more? Are they starting to, they've never really been somebody to go out and skate with their friends, and now they're going out and skating every day? Are they going out and skating and not taking their skateboard? Are they going out and skating and not coming back winded or with sweat in their hair at all? Anything that seems out of the ordinary, that's what we're looking for when we're thinking about our kids. Money disappearing can be one, if they're like holiday money or birthday or allowance. You're not sure where it's going. You're giving it to them every week, and then each week they don't have money or they're asking for money. This is something that parents fall into a lot of, like the kids asking for money, they're giving them money, and they're not really even sure where the money's going to and what they're utilizing the money for. And so these are things when we think about our kids to consider as you're considering, could there be substance use that they're engaging in? And again, none of these things mean there's substance use. They're things to notice, to ask more questions, to start to get engaged. The goal with our kids is to include them and to have them be a part of the family. And so the more we can ask questions and be curious with them and have them partake in these conversations, the more information we will get from them. Looking at adults, it's really pretty similar. We're looking for changes, out of the ordinary behaviors. Of course, the changes aren't going to be related to school unless an adult is in school, which of course happens. Maybe it's a little bit more work performance, being put on a performance improvement plan at work, let's say. Maybe there's a big social change, which does happen with kids as well, but they are no longer spending time with their friends. Some people talk about their substance use as being in secret. Some people talk about their substance use being more social. And so it's not one or the other. Again, everybody is different. But when you think about friends or family or adults in your life and you're starting to wonder, maybe are substances a problem? Did they always used to sleep really well? And now they're not. And they're telling you they don't sleep well for 4 nights in a row. And then all of a sudden they'll just knock out the next night. And those are things to get curious about, to ask, do you think anything changed? What do you think's going on? Why do you think you're having trouble with your sleep? Again, it doesn't mean there's substance use. These are just signs to start to have you be curious about, to ask more questions, to see if they need support, right? These are signs that something is going on, whether it's substances or not, and we want to be there for our friends and our family to be a support to them. And so these are signs for you to start to ask, I've noticed that your mood is more up and down lately, this mood lability. Is there something going on? Is there something I can do to support you or help you? And allowing ourselves to be there and to ask those questions so that we can support our friends and our family as needed. I want to take a little bit of time to talk about dual diagnosis or co-occurring disorders. So we can talk about this in the context of children or adults. It would be a similar concept, and I've alluded to this as we've gone on. But when we look at dual diagnosis, we're looking at somebody who's misusing substances while they're having a mental health disorder, and they're typically using that substance to help them manage their mental health. And so I always explain this to our patients when they come into our program here at Sharp. I always say something's going on in your life. That's this life stressor bubble that we have here. So there's some conflict at work. There is a boss that you're not getting along with at work. Something's happening at home. You're having a hard time dealing with a roommate or a spouse, maybe a sibling or a parent, and you're having a hard time setting boundaries or asking for what you need. Using your words to ask for what you need, as opposed to showing people. That happens a lot for people, that they say, well, surely they knew I was upset. And you say, well, how did they know? And they said, well, I stopped talking to them. And that's an example of asking for what we need, showing our frustration without using our words. And that happens a lot. So there's this life stressor that happens. And as it continues and as it builds and as it gets festers, if you will, kind of gets more and more dug into you, we start to see mental health symptoms pop up. And so we see somebody have a lot of negative thoughts about themselves, or impacts on their sleep or their appetite. We see an increase in worrying about a lot of different things, or nervousness. And so because of this life stressor and now this mental health experience that they're dealing with, it all becomes too much. And so I want to numb out. I want to avoid that pain. And we see substance use or abuse. And so this model is so common. And so when we think about treating this, we go backwards. So we started with the life stressor, to the mental health, to the substance use. And when we're treating this, we start with the substance use. That's a coping skill. So we have to give a new coping skill. We have to create some relief around all of the mental health symptoms, and then dive into the larger life stressors that are leading to all of this. I always say to patients, I can explain this in a few minutes, and it's such a complex idea, and it's so challenging to wrap your mind around when you think about it in relation to yourself. And so it's something we come back to time and time again, really looking at different examples of maybe, that life stressor is, I have a hard time speaking up. And so I don't really set boundaries. And so I'm known in my family as the yes. I'll say yes to everything. And so that becomes stressful, and that becomes so much to deal with. And I start to experience these mental health symptoms of thinking negatively about myself. My self-esteem starts to go down. I stop sleeping so well. My appetite goes away, and I'm just feeling really hopeless that my job is just to help other people and be there for everybody else all the time. And I'll never be able to do what I want to do. And I have to find a way to not feel this all the time. And so I start to engage in some kind of substance use. And just normalizing that whenever any of us have a life stressor, we go to a coping skill. And again, substance use isn't always a coping skill, and sometimes it is a coping skill. And so we want to, if it is a coping skill, see that, notice how it helps, how it works, notice when it's not working and what's not working about it, and provide other options so that it doesn't become I have to use in order to manage. We never want it to be that substance use is the only option that somebody has. And so as we think about treatment, that's really what we're looking towards. So as people look for help, people are going to go to a variety of different places for help. We would love for them to come to Sharp Mesa Vista or go to a therapist, and that's usually not what happens. People start by going to their school counselor, by going to their teacher or somebody that they really trust at school, similarly at work, a trusted colleague or a boss, a supervisor, somebody that they have a relationship with, especially in relation to church, or any spiritual or religion connection that you have, a leader within that community. Emergency rooms happens very often because when people are going through any kind of withdrawal, when people are going through any kind of panic attacks, that's that mental health component. With a panic attack, it really feels like you're having a heart attack and you're dying. And so oftentimes people are seeking medical attention for that and going to the emergency room because they don't know what's happening. People might go to their primary care doctors and get a screener during your primary care doctor in regards to your mental health or your substance use. That might pick something up. So you might go to them, but they might also find that as they're meeting with you, as well as family, friends. Not an exhaustive list, but again, I think it's important to know that people are not going to the therapist when they need help. That's not many people's first reaction. Many people's first reaction are supported people in their life. Maybe it's a coach, somebody that has been around, a mentor or a mom figure in their life. And so for you all that are listening to this, somebody might come to you at some point. Whether you're a provider or not, somebody might come to you saying, hey, I need a little bit of help. And I hope to give you some information so that you might be able to direct them in a direction that can be helpful and be a support to those people. So as we think about treatment and looking at different treatment levels, there's a lot of different levels of treatment, and this pulls in mental health with substance use. And so if for you substance use isn't as pertinent to your story or what you're experiencing, but you can relate to the mental health component, these levels are very similar. The first being detox, different, substance related. But it's important to mention that when somebody has been using alcohol regularly or benzodiazepines regularly, those are the two detoxes that can be fatal. And so those two detoxes we really want done in a medical setting. When somebody is detoxing or withdrawing from alcohol or benzodiazepines, we can see seizures. We're going to see nausea, vomiting, shaking, sweating. And so oftentimes, we have a few options to get rid of them, to come into a medical setting, to get that support, to get medication intervention. And if you're not going in, then to be really honest with you, continuing to use the substance, continuing to drink the alcohol will pull those withdrawals away. Again, I can't say it enough, and we say this to our patients all the time, that these detoxes from alcohol and benzodiazepines can be fatal. And so we want people doing them with medical support, with medical intervention, with medications, so that they can do it safely. Whenever I talk about detox, people always say, what about opiates? Opiate detox is very, very, very painful. People say it's like the flu, but much, much, much worse. The fatal aspect of opiate detox comes in when it gets so painful and the withdrawals are so intense and the body aches and everything they're experiencing that they use, and they use too much and a fatal overdose happens. And so that's where the fatal aspect of opiate detox can come in. But again, opiate detox is very painful in the body in terms of the physical symptoms that somebody would be going through. as they're detoxing. But there isn't that same concern in regards to the medical component and the detox itself being fatal. So detox, if needed, is really important. You can go to an emergency room to get into detox. You can go to a psychiatric hospital or facility to get detox. We always say, go to your nearest emergency room. They can transfer you from an emergency room to a facility that can provide that detox. But as soon as you're in that emergency room, you're going to be able to get that medical attention to make sure that you're safe. And so that's what we're really, really focused on during that period of time. So after detox, and the next level of treatment would be kind of the next step down of treatment would be residential treatment centers. And a residential treatment center is going to be somewhere where you go and you live for a period of time to work on your recovery from mental health, your recovery from substances, the combination of them as well. And so residential treatment centers, again, you're typically in a room. It's like a house type setting. Not always, but you're sharing a room with somebody. You're going to groups and programming and such throughout the day, as well as getting medical intervention, medication intervention, your meals, your therapy, your meetings, your sober support meetings, whatever that might be, all in one. And so that residential treatment center, we always say to our folks when they're inpatient and detoxing, this is a huge step. Coming into detox, getting off the substance is a huge step. And you're doing it with nurses and psychiatrists and therapists and your peers around you. And when you leave, what's next? And it's so, so important that you have a plan for how you're going to continue to support somebody. And so a residential treatment center is a really great option to continue to have support around you, other people who are sober, other people who are wanting and working towards recovery. One step down from a residential treatment center would be a partial hospitalization program. And a partial hospitalization program is going to be, you no longer are staying at the facility, so you're now staying at home, but you go to the facility typically 5 days a week, around 8-hour days, to get treatment, to continue to get medication intervention as needed, to get therapy, to get sober support. But you're going in there at a high frequency, right? 5 times a week, a lot of support when you're in that partial hospitalization level. Then we have one step down. We have an intensive outpatient program. And this is, again, the folks in this are staying at home. They are coming into a treatment facility 3 to 5 days a week, typically around 3 to 4 for 3-hour days. And so this is, again, the intensity goes down and goes down and goes down as you're in treatment, to then get us to the lowest level of treatment here, which is individual outpatient therapy. 1 hour, once a week, going to a therapist, working on your recovery. Important to mention is that individual outpatient therapy can happen while somebody's also in an intensive outpatient program, or while they're also in a partial hospitalization program, dependent on the program and the patient's needs and the treatment plan, really, and a variety of other factors. But what's important about these different treatment levels is that we tend to see the best outcomes when people step down, like if you think of stairs, a step to step to step to step. So they start in detox, and they go to that residential treatment center, and then they go to a partial hospitalization, and then they go to intensive outpatient program. What we always hear from patients is, I have to get back to work, I don't have time. And while there's bills to be paid, and yes, work is important, and yes, you have to get back to your life, I also always think about what's going to happen. Are you going to be able to manage detoxing? You're here in detox for maybe a week, and then you're headed back. Is that enough time to have change created to create change around you, to now have sober support and only go to a therapist 1 hour once a week. And so it's really common that people do not do it in a step-by-step, that they jump a few steps or they jump a handful of steps. And everybody gets to decide their own treatment and what's best for them and what they think their best treatment options are. And at the same time, from a professional, our recommendation is really that people go step to step to step to have the support, to give them the best chances at long-lasting sobriety and recovery as they build their support system. Because oftentimes for folks, as we were talking about in the beginning around substance use, people's world becomes substance use. All of their friends are using, the people they live, the house they're at, the way they manage every time they go to work, the way they cope with family gatherings. And so all those stressors and all those triggers are going to be there when somebody gets out of treatment. And so to have added support and to go in a step-by-step way can be very helpful. So I want to talk about therapy intervention as well as psychopharmacological interventions. When we think about therapy interventions, again, oftentimes substances are a coping skill, a way to manage. And so we want to focus first and foremost, of course, on safety. We want to help them with that sobriety. We want to give them the ability to manage their mental health and to have some relief from their mental health symptoms. And then we want to get into what is that life stressor. Going back to that model of the 3 ovals that we had, right? We're going to make sure safety's there, make sure they're sober and having support around their substance use. We have to give them new coping skills, other ways to manage when they're overwhelmed. Give them relief from the mental health, from the negative thoughts about themselves, from the hopeless thoughts. And then really eventually get into those underlying life stressors that have led to the use to begin with. Some different therapies, I won't go into detail on these, but something for you all to know, different therapies that are oftentimes used with folks who are using substance use. Most motivational interviewing is a very commonly used intervention, a way to collaborate with the person who's using the substances, to have them be the voice of recovery and them be the voice of the desire for change. What can happen oftentimes is when somebody's using substances or abusing substances, that somebody in their life wants them to be in recovery. And we always say that that is great, and it's great to have support, and support is really important, and that nobody can wish somebody to be something else. And if somebody is not wanting to change themselves, that's the biggest and the first hurdle. And so motivational interviewing can be really helpful when we're starting to work with an individual on them building their own motivation and desires for their recovery. We have cognitive behavioral therapy, which really helps us to look at how our thoughts, our feelings, and our behaviors are all interconnected. And that oftentimes we think situations that happen lead us to feel and do, but that in reality, it's our thoughts, that our thoughts are what lead us to feel, and to feel in different levels of intensity. We also have dialectical behavioral therapy, looking at the dialectical, that 2 things can be different and occur at the same time, which is so true with substance use and with motivation, right? I can not really want to be here in treatment in this moment, and I'm going to do my best to listen right now. And so many people want, well, it's this or it's that. Choose. Do you want it or do you not want it? And with dialectical behavioral therapy, we say, let's just roll with what is. That you don't want to be here, and you're here. You're sitting in front of me, and you're doing your best to listen. And so we're going to look at, you're doing everything you can, and you can continue to change and get better and make changes in your life. And so that's where dialectical behavioral therapy can be so very helpful. And then we have acceptance and commitment therapy, really looking at how do we focus on our goals. How do we focus on our values rather than just our goals? How can I enjoy the journey, enjoy the process, enjoy the challenges and the hurdles, and not just be focused on the outcome? I want this or it's a failure. I want to achieve this or I haven't achieved anything. But how can we learn how to manage the whole journey as we go and enjoy it? And so when we look at therapy interventions, that's really oftentimes what we're looking at related to substance use. On another side of it, and a similar coin, psychopharmacological interventions are really important when we think about mental health and when we think about substance use. And so what's commonly referred to as Antabuse is a FDA-approved common medication that's used. We have patients take this medication and it will interact with any alcohol that they consume. And so it's a deterrent to use alcohol because it's going to create them to be very sick if they use alcohol and take their Antabuse. And so this is a medication that can help somebody who's dealing with alcohol abuse disorder or alcohol use disorder. We also have naltrexone, which has a pill option and an injectable option. This is really going to be FDA approved for cravings around alcohol use disorders as well as opiate use disorders, a way to help manage the cravings. There's a lot of behavioral interventions we want to do, and that's the therapeutic side of this. And medication helps some people, and so we want them to take the medications that are prescribed to them that are going to be helpful. Suboxone is another, it's buprenorphine, but it's commonly referred to as Suboxone, treating opiate dependence, which can be very helpful and a safe way to manage to go off the opiates, to go into some withdrawals, and then to get on Suboxone to help you. We also have gabapentin, important that I mentioned, not FDA approved, but that they do use it in folks with alcohol use disorders to help around the cravings, although naltrexone would be more commonly used. Some of this can be taken in combination together. This should always, of course, only be taken as prescribed by a physician for you. But what I think is important is that treatment for substance use is not just one thing. We have the therapeutic interventions, we have the behavioral interventions, but again, medication can be a really important part of people's treatment as well. And so that is an option. Another piece around treatments related to opiates is that what happens when somebody overdoses on an opiate or even takes an opiate is the opiate attaches on to the opioid receptors within the brain. And so when somebody is having an opiate overdose, Narcan or naloxone can be a life-saving intervention. I mention this because it's really important when we talk about substance use. This comes in a nasal spray as well as in an injectable. Most commonly, we use the nasal spray. EMTs carry this. The emergency department is going to have this. We now have 3 different Narcan vending machines throughout San Diego where folks can get Narcan. Your primary care doctor can always give you a prescription, but Narcan, if somebody is overdosing on a substance and you're not sure what it is, and you give them Narcan, there's no negative side effects per what doctors are reporting to doing that. And if we don't give the Narcan, there could be a lot of negative side effects of somebody's life. And so what we say, utilize the Narcan. It's meant, of course, get education and training on how to utilize it, but it can be a very life-saving intervention. Even if you think, nobody in my house abuses opiates, but if there are opiates in the house, somebody could accidentally overtake them. A kid could get a handle of it and accidentally take too much. It doesn't always have to be just from addiction. It could be from accidental overdoses as well. And so important for me to mention the benefits of Narcan and the access that San Diego is doing an incredible job for us to now have. I want to talk quickly about some community resources. Support is imperative. Sober support is so important. And that's a huge part of recovery. And so we always say here at Sharp, and I can't speak for other facilities, but that we have no opinion over what kind of support you get. We just know you need sober support. We know people do best when they have other people around them supporting them and being there for them. And so there's tons of anonymous groups, smart recovery groups, celebrate recovery. There's a lot out there. The Phoenix.org is a great organization that has activities for sober folks. And they go to the movies and they hike and they surf and they swim and they do arts and crafts and they walk and they do things together, because you need a support system. You need somebody who gets it, who you can go to when you're having a hard day, who can say it's not worth it, don't use, don't pick up. And so having that support is really important. It's also extremely important as a support person to have support. Al-Anon is a great resource that's out there to help people who are loved ones of addicts, of people who are struggling with substance use. And having your own support, of course, therapy is an option as well, but having your own support is going to be really important. So we have community resources. We also have treatment at Sharp. And I'll give on the next slide some information in terms of phone numbers for you to call. But just looking at what's out there, we have our child and adolescent partial hospitalization program. We also have our adolescent changes intensive outpatient program. And this changes program is specifically for adolescents who are struggling with substance use and really substance abuse. We do have folks in our child and adolescent partial hospitalization program that also are struggling, but the changes is specifically set up for folks, for adolescents that are struggling with their substance use. We have our dual diagnosis intensive outpatient program that has morning and evening options here at Sharp Mesa Vista. And then we also have the Sharp McDonald Center. And at the Sharp McDonald Center, we have residential treatment options, we have partial hospitalization, and intensive outpatient in the daytime and evening as well. And so sometimes people need to continue to work while they're in treatment, and that option is available. For adolescents, they need to continue to be in school full time and go to treatment, and that option is available. And so oftentimes people write off treatment, I think, just a hair too soon before they have all the information. And so if you are looking at treatment for yourself or for a loved one, spending that time to look at what all your options are can be super helpful. We have for you here the phone numbers. So if you're looking for an assessment for a child or adolescent or adult, both at Sharp Mesa Vista, and then if you're looking for the Sharp McDonald Center, which again has that residential option as well as the partial hospitalization. These are numbers that you can call in order to be able to gain an assessment that is complimentary, that's a way to figure out what are your next steps and what are you needing. As we get here near the end, I want to share this final quote with you all, which was from somebody who is in recovery, and they said, "Never underestimate a recovering addict. We fight for our lives every day in ways most people will never understand." And I think it's so easy for us to sit on the sidelines and point our finger and judge people. And I think this quote is so nice, looking at the desperation of we fight for our lives in ways that people won't even understand. And that this is not when somebody gets to the point of abuse and addiction, that it's not a choice, that it's something that they are really struggling with. That's a disease that they need treatment for. And we want to be able to be there for folks, whether you're a provider or a family member or a friend. We want to be able to be there for people in those moments to really support them and help them. So I want to take some time to answer any questions that might be coming up as we go through this, and before we wrap up for the day.
Yeah, Shelby, thank you so much for all of the really great information that you provided. To submit a question, please click on the Q&A icon on the toolbar and type your question in the prompt. Please keep in mind that your question could be seen by all participants. Yes, and Shelby is here to answer any questions that that you may have. While we're waiting for a couple of questions that we may receive, I wanted to ask you, Shelby, a question that we received before is, could you talk a little bit about relapse and how does Sharp Mesa Vista help a patient who may relapse?
Yeah, that's a great question. We always say relapse can be a part of somebody's recovery process. Doesn't have to be, but it can be. And that recovery and treatment is all built on honesty, on trust. And so within Sharp Mesa Vista, we always say when there's a relapse, if there's a relapse, we want you to tell us. We don't want to find out from your breathalyzer or your urine drug screen test. We want you to tell us, because then we get to find the holes in the plan. We created this plan of how you're going to stay sober, and you relapsed. So there was holes in the plan. It can actually be good news in the sense that now we can find a way to fill these holes in. Maybe somebody says, I didn't even realize that family gatherings were going to be really triggering. And so now they've had this experience, they had this trigger, they had this relapse, and we get this opportunity that come holidays, come upcoming family gatherings, we know there needs to be extra safeguards in place and barriers in place in order to support this individual. And so that relapse can really strengthen somebody's recovery.
That's a really excellent answer. Thank you so much. Another question is, what kind of support services does Sharp Mesa Vista provide for loved ones of patients who are receiving substance use treatment?
It's a great question. So again, loved ones need support too. So within the Sharp McDonald Center, as well as within our dual diagnosis program here at Sharp Mesa Vista, we have family support groups. Within the dual diagnosis program, we have what we call our multi-family group, where loved ones and support people get to come and be a part of treatment with their person that's dealing with their mental health and their substance use. We also have resources through the Sharp McDonald Center, where families can come even when your loved one is not in program yet, in order to become a part of our family group to get support. And so there's a lot of resources out there because support people need support too. And that's so important.
Great, thank you. And the last question is, could you please speak about what barriers might exist for someone that prevents them or makes them kind of struggle to want to get treatment or to seek treatment?
Yeah, absolutely. You know, there's so many barriers to treatment, and this is going to be individually based. But a lot of times, you know, there can be a financial barrier to treatment based on insurance and access. There could be a time constraint of I have to work during the day, but then at the end of the day, I have to watch my kids, and I don't have childcare, and a financial component of that as well. There's also a lot of times the mental barrier that we can set into place of thinking, well, I can't do it and nothing's going to change and I'm not going to get better anyway. And a lot of that self-defeating talk that we can do that gets in the way of us getting our treatment. And so I always say, like, there are resources out there. It's not going to be easy. I'm upfront with my patients from the very beginning. This will not be easy. I can promise that. And I can also promise that it'll be worth it. And this changing your life in a way that you want will be worth it. And so reaching out for help, asking at the school if there's any options for childcare within your religious community, family, friends, support is the biggest thing. People come in and say, I have no one, because they haven't shared, because they're embarrassed, because of their shame. And so having support, having people around you gives you more ability to knock through some of these barriers to get the treatment that you really deserve.
That is an excellent answer. Thank you so much, Shelby. We really appreciate everyone for joining us today, and we hope that you found this webinar to be informative. You will receive a link for a survey once this presentation concludes. We would appreciate your feedback on this webinar. If you have any questions, please contact Shelby, who was our presenter. Again, she's the clinical lead of the Dual Intensive Outpatient Program at Sharp Mesa Vista. On the screen is her phone number and her email address. And we look forward to, again, like I said, your feedback on today's webinar. On behalf of Sharp Healthcare, thank you so much. Be well, and I hope you have a great rest of your day.